Ma'am, how are you doing, Dr. Lovelina? How's your
I'm
Monday?
great. Thank you. It's a pleasure to be sharing the stage with you. Very nice.
So, of course, Dr. Lovelina, we're going to talk about that one topic that is still very taboo, which we don't talk about. Every time I mention it on radio, people are like, "Kaise bol diya?" And I believe it's World Contraception Day. So, why don't you tell us first, whatever you'd like to tell us about contraceptions, about pills, about a woman's right to choose, about the
Yes.
woman's ability to define her body. Go ahead, ma'am.
So, there are various contraceptive methods available in the market.
Hanji.
First of all, it is the fertility awareness method that people should know. We counsel the patients for the fertile days. So, generally, the first day of the period is taken as the first day of the cycle. And, generally from the 10th to the 16th day is the fertile period. So one has to avoid contact during mid-cycle, generally 1 week from the start of the period, and 1 week before the period starts is considered as the safest day. Then we have, barrier methods like, male condoms, we have female condoms, we have a diaphragm, we have a sponge. So these are just barrier methods, like they are physical methods. And then we have, hormonal, in that we have oral and we have long-acting reversible intrauterine devices. So in oral, we have oral contraceptive pills. Now, oral contraceptive pill is nothing but, it is like an oral contraceptive tablet which contains two hormones, estrogen and progesterone, and it is used to prevent pregnancy. Now, main mechanism of action is that it does not allow the eggs, to mature. So when that happens, it inhibits ovulation. When ovulation doesn't take place, pregnancy doesn't take place. Plus, the cervical mucus becomes thick. So the sperms cannot travel smoothly. It inhibits the migration of sperms, so it prevents pregnancy. Now, there are a lot of myths around oral contraceptive pills, but let me tell you, they are safe, and the failure rate is just 0.3%. And if there are timing errors, or sometimes people forget to take, so sometimes due to that the failure rate may go up to 9% because of non-compliance. Kabhi hum bhul jate hain. So it is like that, but it is absolutely safe. The advantages are lots of pills, but one thing I want to tell the viewers is one must take it at the same time every day. One should not try to go beyond 24 hours, should be taken during that time. And sometimes if somebody fails to take the pill, forgets to take the pill, so they should take it as fast as possible.
And I have a quick question. This is a question that a lot of people have with pills. You've forgotten to take it. A lot of people conveniently take in two.
So they should take it whenever they remember, and the next day pill has to be taken at the same time.
So not that you're having two pills at once.
No, not two pills. You have to be, first pill has to be taken as soon as possible. So, otherwise the efficacy.
A lot of women feel that these pills will make them gain weight, which we see is a huge lifestyle thing. So why don't you tell us about that?
Okay, so of course, as you said, it's a common thought that they are going to gain weight, but actually there's just slight water retention. There is no fat gain. Okay, so and that goes away, in 2-3 months. So it is just a temporary phase, but it is just a thought process. And the best time to start a pill is generally on the first day of the cycle. So if we start on the first day, the efficacy is maximum. But in case we are starting between 7 days, always the first day of the period is taken as the first day. So if we are starting, on the 7th day or in between, then the protection does not come for the first week. They can use some other barrier method like a condom. This is what I wanted to tell. Okay. And
the second thing that I wanted to ask you was that recently a lot of people have started talking about IUD.
Yeah.
Right. And then there's also this whole thing that a lot of times they're very scared to, because it's an external thing put inside your body. Is it going to cause harm in the long term? Will it remain inside? Will the thread get lost? There are like a million myths about this. So why don't you clarify that as well?
Okay. So first of all, IUD is an intrauterine device, also known as long acting reversible contraception. Okay.
Hmm.
So the advantage is it does not require partner participation.
At
Once
all.
it is put inside, you can just forget about it.
Hmm.
And the return of fertility is immediate. As soon as we remove it, the fertility returns. Okay. Now there are various types. One is like a copper T. The copper T is, it's like a coil. Okay. It's like made of polyethylene, and copper is wound over it. So there is a slow release of that copper, and what it does is it thickens the cervical mucus. So the sperms, they cannot travel, and it prevents pregnancy because cervical mucus becomes hostile. And do you know, it is so safe, the failure rate is just 1.9%. I mean, that's hardly anything. And the advantages are many. It is effective in preventing pregnancy in 99% of the cases. It can last for 5 to 10 years, depending on what type of IUD you are putting. It is safe to use even while breastfeeding, because sometimes during breastfeeding, all the oral contraceptive with estrogen cannot be given, but can be used. So then there is no interaction with any other medication. The onset of action is immediate. It is independent of sexual activity. It is low cost, low maintenance. Fertility returns immediately. There are no hormonal side effects like nausea, headache, breast tenderness. It is tiny. Nobody can feel it. So I think there are a lot of myths, but it is the most convenient thing to put it inside. Now, the concern, as you raised, there can be very rarely something that, it gets misplaced, or the string might get lost, or sometimes the patient might expel, or if it is rarely it can cause perforation, go through the uterus. Now everything comes with fine line. There's nothing like 100%, but 1.9% failure rate is hardly anything, and it is one of the safest intrauterine devices. But of course we have others which have hormones in them.
Okay, ma'am, a lot of people, which I thought was the really weirdest myth ever, was that if you use contraceptives, it could lead to infertility. I mean, I haven't heard of anything as stranger as this, so I wanted you to address it.
Okay, so as I said, with IUD, fertility returns immediately as soon as we pull it out. With oral contraceptive pills also, the fertility, returns immediately, means there was a survey conducted, a study has been conducted, and it has seen that in 97% of people, it returns within 1 to 3 months. So it is nothing to be scared of, nothing, absolutely.
So you can. Now, what's a short term or a long term of contraception? I'm assuming IUDs would be longer term. Short terms would be.
Short terms are, as I said, there are barrier methods like condoms, like sponge, diaphragm, oral contraceptive pills. See, the pills can be given either in a cyclical way. That means, people will bleed monthly. Women can bleed monthly. They can be given every 3 monthly. Or it can be given continuous. So depending on their medical requirement, their personal choices, it can be given for 1 month use, 3 month use, continuous use. And the benefits of IUDs are like, it can, also prevent against a lot of non-contraceptive cases like PCOD, for example, adenomyosis, endometriosis. It can be used, in a lot of other non-contraceptive uses. It keeps acne under control. It decreases your PMS. It decreases the risk of ovarian cancer, endometrial cancer. So, these oral contraceptive pills, there are lots of advantages. The periods become regular, they become lighter, they become less painful. So a lot of myths, but actually they're absolutely safe.
I would suggest that every woman should go and speak to their gynac, have a straight, open discussion. A lot of women believe that the toughest thing about going to a gynac is a little bit of judgment about their sexual activity. I hope that goes away as well. Very, very important. Ma'am, currently there is a FB Messenger chatbot called Tanu, which comes in. You can also get relevant information about contraception through that. Please go check it out. And of course, this session has been issued in public interest by Bayer Zydus Pharma. Dr. Lavlina, it's been a pleasure talking to you. I hope all gynacs are as easy to talk to as you and as warm as you.
Thank you so much. It has been my pleasure. Thank you for having me today.
Thank you, ma'am.